Hi, let's see an NCLEX RN video based on assessment of integumentary function. Which properties of the epidermal and dermal layers contribute to wound healing? The 30-day maturation time of epidermal keratinocytes, eccrine gland sweat production, melanocytes in a 1:36 ratio with keratinocytes, presence of Langerhans cells, macrophages and mast cells, blood vessels in the dermis and subcutaneous tissue. The maturation time of the epidermal keratinocytes and the replication of keratinocytes within the hair follicle impact the rate of wound closure. Langerhans cells, macrophages and the mast cells are part of the skin immune system which play an important role in orchestrating the healing process. Blood vessels deliver oxygen and nutrients and remove waste products produced by the immune system cells. So here the properties like the 30-day maturation time of the epidermal keratinocytes, melanocytes in a 1:36 ratio with keratinocytes, presence of Langerhans cells, macrophages and mast cells, as well as blood vessels in the dermis and subcutaneous tissue contribute to wound healing. Which statement accurately describes the skin's protective capabilities? The epidermis can resist damage when exposed to continuous moisture. Melanocytes always provide adequate protection to underlying structures from UV exposure. Langerhans cells located in the epidermis often provide the initial signal to the immune system that pathogen invasion has occurred. Temperature is regulated by blood vessels and sweat glands. While the skin has many protective features, the presence of Langerhans cells, which are the outermost cells of the immune system, triggers the immune system response to invading pathogens. Which clinical finding requires additional investigation by the nurse? CRT less than 2 seconds, new onset petechial rash, a macule with symmetrical shape, regular border and uniform color, pale or cyanotic nail bed after exposure to cold temperatures. A new onset petechial rash indicates microvascular dysfunction. The underlying cause for this finding must be immediately identified to minimize risk for uncontrolled bleeding. The nurse is teaching skincare guidelines to the caretaker of a 79-year-old incontinent female who has a total Braden scale of 14 with a score of 2 in the mobility category. What are appropriate educational priorities? Gentle cleanse and dry the skin immediately after an incontinence episode. Utilize a toileting schedule to minimize episodes of incontinence. Aggressively clean the patient's skin after an incontinence episode. Assist the patient with repositioning at least every 2 hours. Use diapers for stool and urine containment. The patient has a number of risk factors for developing skin damage. These include excessive moisture caused by incontinence, immobility, and increased fragility of the skin due to advanced age. Choices A, B, and D, that is gentle cleanse and dry the skin immediately after an incontinence episode, utilizing a toileting schedule to minimize episodes of incontinence, and assist the patient with repositioning at least every 2 hours will help manage these risk factors. A patient presents with a new onset erythematous rash that contains intact pustules. Subjective symptoms include itching and burning. Which diagnostic evaluation is most helpful in determining the underlying etiology? Excisional biopsy, skin scraping, sterile collection of pustule roof, cryosurgery. The objective appearance and subjective symptoms are consistent with fungal infection. The recommended culturing method for fungal infection is to sterilely remove the roof of an intact pustule so that the tissue can be inspected using a KOH preparation. The nurse questions which intervention in a stable patient with a nursing diagnosis, impaired skin integrity related to draining skin lesions on right lower extremity. Place patient on isolation precautions. Obtain a swab specimen from wound bed after cleansing with a non-antiseptic solution. Educate patient about wound and skin treatment regimen. Administer broad-spectrum antibiotic before obtaining a culture. In order to obtain the most accurate result, the culture should be completed before administration of the anti-infective agent or cleansing with an antiseptic solution. So administer broad-spectrum antibiotic before obtaining a culture. So that is a thing we need to question. Which patient is at greatest risk for pressure ulcer formation? A 39-year-old male, status post mitral valve replacement with a Braden score of 18 who is NPO for procedure. A 76-year-old female with an ICD pocket infection, Braden scale of 15, incontinent of urine and stool. A 52-year-old female heart transplant patient in rejection, Braden score of 15, one person assist to stand. A 67-year-old male, status post CABG into 4 days, Braden scale of 16, who needs assistance with repositioning when in the chair. The patient described in B, that is a 76-year-old female with an ICD pocket infection, Braden score of 15, incontinent of urine and stool, has the most significant risk factors including advanced age, mild to moderate risk of pressure ulcer development based on the Braden score, and excessive moisture caused by incontinence. In a patient with incontinence-associated dermatitis caused by frequency loose stools, the nurse includes which intervention in the plan of care? Vigorously scrub skin to remove contaminants, use diapers to contain urine and stool, use invasive containment devices in the presence of diffuse partial thickness wounds, avoid using skin protectants. The need for stool containment should be based upon the severity of the incontinence symptoms, the patient's ability for self-care, and the severity of skin damage. Invasive containment strategies should be considered in the presence of diffuse skin breakdown, particularly when a patient has poor mobility. Which information should be included in the teaching plan for a patient diagnosed with melanoma? Teach the ABCD tool for detecting abnormal skin lesions. Avoid wearing sunscreen. Clothing is adequate to protect our skin from sun exposure when outdoors. Discuss pain management plan for removal of skin lesions. Review biopsy or excisional site care instructions. In a teaching plan regarding treatment and prevention of melanoma, the nurse should emphasize guidelines regarding detection of new sites, pain management, and site care instruction to promote healing. So here, teach the ABCD tool for detecting abnormal skin lesions. Discuss pain management plan for removal of skin lesions, and review the biopsy or excisional site care instructions. Which observation in a patient with peripheral vascular disease requires an immediate intervention by the nurse? Gradual hair loss on bilateral lower extremities, hemosiderin staining on bilateral ankles, 2 plus dorsalis pedis pulses bilaterally, new onset pallor, cyanotic or ecchymotic discoloration of distal toe tips. The skin changes associated with peripheral vascular disease often develop over time. New onset discoloration in the form of pallor, cyanosis or ecchymosis of toe tips represent an acute change such as a blood clot that requires immediate intervention. When caring for an obese patient, which action represents a skin assessment technique that is unique for this population? Thorough inspection of all skin folds for the presence of lesions, functional ability to provide adequate self-care, gather data about recent skin changes or discomfort, personal motivation to lose weight. This obese patients frequently have increased moisture and friction under skin folds of the breast, penis, and back that may lead to full thickness wounds and infection. So we need to thoroughly inspect of all skin folds for the presence of lesions. Bloom is a 72-year-old Caucasian female patient who presents to her healthcare provider because of recent skin changes on her anterior chest. She reports itching, burning, redness and blistering at the site as well as a low-grade fever. Also, she has an allergy to latex but has not had a recent exposure. Because of Ms. Bloom's advanced age, her skin is at increased risk for dryness caused by physiological changes associated with aging. She has struggled with being overweight since her late 30s and her current BMI is 28 kg per meter square. Ms. Bloom denies any recent dietary changes or any travel outside the country. Ms. Bloom reports spending a lot of time working outdoors in her garden and she regularly wears sunscreen. Her daily skincare regimen includes bathing and moisturizing her skin once a day, and she reports using a new fragrance spray for approximately 2 weeks. Overall, Ms. Bloom's skin has a healthy appearance. All of her nail buds are pale pink and display capillary refill time less than 2 seconds. She appears to have adequate moisture balance as evidenced by the absence of cracks, excessive dryness or scabs. The skin, hair and nails are clean and well groomed. Hair distribution is approximate on basis of age and gender and it is appropriate. The rash is located below the neck on her anterior chest wall and it measures 6 cm into 8 cm into 0 cm which correlates to the length, width and depth. The site has erythema with a well-defined border and an increased warmth in the comparison with surrounding skin. Within the 6 cm into 8 cm into 0 cm erythematous area, there are scattered serous-filled intact vesicles that are localized to the chest. The affected area appears to have increased moisture, but there are no localized signs of infection. Ms. Bloom reports a low-grade fever, pruritus and burning. The provider orders a collection of a sterile swab culture of a vesicle base to rule out an infectious source. On the basis of the information gathered in history and physical examination, this rash is characteristic of an allergic contact dermatitis brought on by the recent change in patient's fragrance. The nurse teaches Ms. Bloom to discontinue the new fragrance and explain how the rash may progress, explaining that the contact with the new spray led to an acute allergic contact dermatitis. The nurse describes that the rash will most likely develop into vesicles opening into erosions that will then crust and eventually flake off. Which skin layers have been affected by Ms. Bloom's allergic contact dermatitis? Dermis only, epidermis only, both epidermis and dermis, subcutaneous tissue. Vesicles and erosions, they are limited to the epidermis only. When a sterile swab specimen is collected, which statement best describes the correct technique? Rotate swab with gentle pressure within a 1 to 2 cm square area of non-viable wound tissue. Saturate swab with drainage found in base of the wound. Rotate swab with gentle pressure with a 1 to 2 cm square area of clean wound tissue. Clean the wound with an antiseptic solution before obtaining the specimen. To ensure that the sterile swab specimen is representative of the infective agent that has invaded the surrounding tissue, fluid should be expressed from a clean portion of the wound bed. So we need to rotate the swab with gentle pressure within a 1 to 2 cm square area of clean wound tissue. What information is important to include regarding site care instruction for the healing rash? Clean skin with an abrasive surface to remove dried substance. Moisturize the drying rash with emollients to soften and gently remove the crust. Manually drain the vesicles. Avoid showering while rash persists. Site care for damaged skin involves gentle cleansing and moisturizing to support the growth of new epithelial tissue. The nurse recognizes which description is indicative of a vesicle. Less than 1 cm in diameter, circumscribed, elevated serous film. Size varies, circumscribed, elevated, pus filled. Less than 1 cm in diameter, circumscribed, elevated, palpable, firm. Greater than 1 cm in diameter, flat, elevated, firm and round. Rough. So the vesicle, it is less than 1 cm in diameter, circumscribed, elevated and it is serous filled. And it is located in the epidermis. The nurse correlates which surveillance cell present in the epidermal layers as introducing the allergen to the T cells. Macrophage, Merkel cells, mast cells, Langerhans cells. Langerhans cells are the outermost cells of the immune system and are located in the epidermis. The cells take up the antigen, travel to the lymph nodes and present the antigen to the T cell of the immune system. The T cells play a key role in cytokine release, which leads to the inflammatory response that occurs in allergic contact dermatitis. Hope you understood this video. Thank you so much for watching. Please do subscribe.